Hi, so this presentation is on polio and post-polio syndrome by myself, Elaina. So what is polio? The full name for polio is poliomyelitis. It is a virus caused by the polio virus. There are three types of polio: type 1, type 2, and type 3. Both type 2 and type 3 were eradicated, type 2 in 2015 and type 3 in 2019. Type 1 has not been declared eradicated as of right now. You must protect against all three of the polio viruses, and the only way to do that is through the vaccine. The vaccine is an inactive polio virus vaccine, and it was created in 1955. This is the picture of the polio virus, and the map at the bottom shows the amount of 1-year-olds who have been vaccinated against polio. As we can see, some of the African countries have the lowest rates of 1-year-olds who are vaccinated, and that will be seen throughout in developing countries because vaccines are not readily available to some of these countries. So the pathophysiology of polio, it is very, very contagious. It is spread through person-to-person contact. It is a disease that is only seen in humans. So it is spread through droplets, which are caused by sneezing, coughing, drinking beverages, anything like that. It is also spread through an infected person's fecal matter. It is often transmitted through contaminated food or water, and in the currently that is more seen in developing countries because they are not able to have that clean water, to have that clean food. So we can see that the reports of the polio cases are up more in the African regions where the developing countries are located. The symptoms of polio, it's mostly just flu-like symptoms: fever, tiredness, sore throat, headache, stomach pain. Most people will not see any symptoms with their polio infection. So 72% of people affected do not see any symptoms. There is 1% of people that do get a paralysis caused by polio. The polio virus infects and attacks their spinal cord, and this causes the paralysis. And when children do recover fully from their polio infection, but they develop paralysis-like symptoms in the future, this is called post-polio syndrome. So how does polio attack the nervous system? It attacks the motor neurons, and this is what sends messages from the brain to the spinal cord and from the spinal cord to the rest of the body. So if the motor neurons are damaged, there are no messages being sent from the brain, so there is no messages being received to the spinal cord or the rest of the body. It mostly affects the legs, but it can also travel to the trunk, thorax, and abdomen. Surviving cells can create new nerve endings, but once the paralysis happens, you do have to recover from that. There is no, just by surviving cells creating it does not cure the paralysis completely. You have to go through therapy and stuff like that. So what is post-polio syndrome? So this is a condition that affects people after their initial polio infection. So this is mostly seen 15 to 40 years after their initial polio infection, and it affects 25 to 40 people out of every 100 people who were infected with polio. The symptoms of this include muscle weakness, tiredness, joint pain, and muscle atrophy. Most people do have just minor symptoms, while other people will develop the muscle atrophy, and you can visibly see the thinning of the muscle mass. Symptoms do occur gradually, and they do get worse with time. So what is the cause of post-polio syndrome? The complete cause is not known. There are theories of what causes it and why it happens. The polio virus does attack the motor neurons in the brainstem and spinal cord, and that's what causes the paralysis. And then as this happens, new branches do form. And it's one theory is that the nerve cells can be overwhelmed and overworked by this new development of new branches, and it can cause that muscle soreness and tiredness. Some other ideas is that this is an immune response, so it's kind of like an autoimmune reaction to where your own body attacks the new nerve cells because they do not recognize it as a new nerve cell and they think of it as a foreign body. So how is PPS diagnosed? There is no specific test that is totally specific to post-polio syndrome. It is often diagnosed by a thorough medical history. So first off, obviously you do need to have history of an initial polio infection. They also look for a period of time to where the patient had no symptoms, they have fully recovered from that initial polio infection, to where there was no paralysis and everything was okay. And they also look for progression of the muscle weakness, so they'll ask the patient if they've noticed that if this has gotten worse over time. A physical exam is needed because it just examines how much muscle weakness is in a certain patient. MRI and a CT of a spinal cord are also needed. That is the first picture on the right. A muscle biopsy can also be used to help diagnose it, and that is the bottom picture on the right. And electrophysiological studies are also used as well. So treatment and cures. There is no cure for post-polio syndrome. There are only treatments. The only cure for polio is to get the vaccine. So before the vaccine was created, people with polio did not have any way to cure polio. So treatments for post-polio syndrome, one is medications. Pain relievers can be used because there's a lot of muscle soreness, fatigue, stuff like that. So ibuprofen, Advil, stuff like that is used to just help with that muscle soreness. Gabapentin is a medication that is used for nerve pain because there are damaged nerves and nerves that are regenerating. There is a lot of nerve pain seen with people with PPS, so gabapentin is used to help with that. Physical therapy is a huge one because once the paralysis occurs, you have to work back to get that strength back, and it's the same way with muscle atrophy and stuff like that. So physical therapy is a big one. Speech therapy is also a huge treatment because there are a lot of muscles in the face, and when muscles in the face get weak, there can be loss of speech or speech impediments, so speech therapy is used. Sleep disorder therapy is used, as well as energy conservation therapies. And energy conservation therapies is just techniques on how to make your everyday life a little bit more energy conservative. So, like, even just using a cane, using a walker, that can help you conserve energy when you're walking. So that is a good therapy for people with PPS. So our case study is, we have Mr. Smith. He is 77 years old. He was infected with polio in 1950 when he was 5 years old. During Mr. Smith's initial infection, he had symptoms such as fever, tiredness, and mild paralysis and muscle stiffness. He initially recovered from the initial infection, but around 35 years later, Mr. Smith noticed a decrease in muscle strength. He went to his primary care provider, where he was diagnosed with post-polio syndrome after a medical history, physical exam, MRI, and muscle biopsy were taken. Over the years, he says he's gotten weaker and weaker, and his lifestyle has gone from moderately active to sedentary within the last year. He usually uses a cane to walk around and ambulate, and his goal is to get back to his normal life, which he had before this. He used to go on daily walks with his wife, he used to play with his grandkids, but because his muscle weakness has progressed, he's unable to do those things anymore. He does not have any other diagnosed health conditions. His blood pressure was 124/82, blood glucose was 90, heart rate was 70, and BMI was 19.3. So the exercise test I would perform on Mr. Smith would be the chair stand test. So he would just stand completely up and then sit back down completely, and I would do this for 30 seconds and count how many times he could successfully do this. This tests his the strength in his leg muscles as well as endurance, and Mr. Smith got a score of 10, which is a below average score. I'd also have him do a timed up and go test. So this is where he starts sitting. When I say go, he gets up from the chair and walks to the 3-meter marker, turns around and comes back to the chair, and sits again. I would time him during this, and this just tests his gait and balance while walking. He did use his cane during this, and he scored. He did this in 20 seconds, which is an average to below average score. So it just shows that he needs the cane to walk and struggles with his gait and balance a little bit. I would also do a handheld dynamometer test. I'd have him sit with his elbow flexed at 90 degrees and squeeze as hard as he could. Because I tested his lower extremity muscles, I also want to test his upper extremity muscles. So I would use this to do that. His right arm was 21.1 and his left arm was 19.8. So for his exercise prescription, some precautions to take in mind for people with post-polio syndrome is strength training is not usually recommended for people with post-polio syndrome because it could further damage these muscles that are already damaged and weakened, and that's something that we do not want to do. Fatigue is also a very common symptom that comes along with post-polio syndrome. So we want to prevent doing any physical activity that will cause muscle soreness or any intensity that will cause muscle soreness. And we want them to be able to perform their daily activities after physical exercise. So we do not want them to, we don't want to cause any soreness or fatigue. Progressions of exercises should also be very slow because a lot of these muscles have been inactive for many years because they are so weak. So we do have to be careful and do progressions over slow amounts of time. So I would use aerobic activity 3 to 4 times per week, every second day. So we do not want to do back-to-back days again because of muscle soreness and fatigue. We want to go up to 30 minutes. We do not want to start with 30 minutes. For progression, I would add 1 minute every day they're exercising until they get up to 30 minutes, and it's light to moderate intensity. Aquatic exercise is also a great form of exercise for people with PPS because it helps prevent fatigue that like walking or running on the normal ground could, because it's easier on the joints, bones, stuff like that. It can help with strengthening, flexibility, and aerobic exercise. I would do the same duration, intensity, frequency, progression as the aerobic exercise. I would also perform balance training 2 to 30 times per week, minimal to moderate intensity for 20 minutes. For Mr. Smith's prescription, I would start him with the stationary bike for 10 minutes because his balance is a little deteriorated. I would increase that 1 minute every day he's exercising until he gets up to 30 minutes. He can also substitute this for an aqua type of walking or exercise. I would also do balance training on Mr. Smith. It would have to be done with supervision because, again, his balance is impaired. I would have him do heel-toe raises, obstacle training, tandem walking for short periods. And once his balance is improved, we can progress him from the bike to walking with his cane. I do not want to hop right on walking just because his balance is impaired. So the conclusion for this is even though polio is eradicated in many places, the effects of polio are very prevalent. There's only one way to prevent from polio and the further causes of like post-polio syndrome, and that would be to get vaccinated. Post-polio syndrome is a cause of a lot of muscle fatigue, so these precautions that I said are very, very important because we do not want to impair people with PPS any more than they already are. Thank you for listening to my presentation on polio and post-polio syndrome.